So if you're a nurse on that unit, you're probably going to have anywhere from 4 to 5 patients on day shift, maybe some more on night shift. But let's go through a shift. Let's pretend day shift. We've got 5 patients and you're on a cardiac unit. So you're going to get report from the previous nurses. So I get that information on my 5 patients, and then I think, okay, I've got to go see them all. I've got to order my day. It's called time management. So I have to think about what's most important that needs to be done first and simultaneously manage this care for 5 patients. And it's going to be your job as that cardiac nurse to know what the diagnosis is, what the typical treatment plan is, what you can expect, and how to translate that into layman's terms for your patient. So that's kind of your patient education aspect. And boy, those patients and their loved ones need a lot of education and support, and it's coming from you. So the way it typically works though is that, maybe you've got a cardiologist or a cardiovascular surgeon seeing your patient. Well, they round once a day, usually, typically sometime in the morning. But then you're the one who stays at the bedside the whole time. You're the one who monitors their vital signs, their labs, their cardiac monitoring, their telemetry, and you're monitoring that at the bedside with all of your patients continuously throughout your entire shift. And then you communicate and take the initiative to call the physician when the patient is going off path of what was understood. So you've got report on all your patients, and now you're going to go into each patient's room and complete a head-to-toe assessment. So you're going to look them over in a very systematic way, and you're going to see, okay, this is the baseline. This is what I know at the beginning of the shift. So if something changes, this is what I refer back to. You'll assess, you'll give your cardiac medications, and while you're doing all that, you're going to do critical thinking. That means, I have these list of patient medications I have to give. I have to make sure that, yes, it is appropriate that the patient receives this medication. Call the provider and say, hey, here's what the assessment shows. Here's what the vitals are. Here's what the medication is and the amount. Do you want me to give it? And then, they tell you what they want you to do. But it's your job as the nurse to notice those situations that require that further notifying the provider and addressing it appropriately. You may also give perform procedures. You may also have urgent and emergent situations come up. You're also going to move patients to different units as necessary. So if you're in the ICU, you may transfer patients out to the nursing floor. If you're on the nursing floor, you're most likely going to be doing a lot of discharges. So you're sending your patients home to rehab facilities, nursing homes, wherever they're going, you're going to facilitate that. And you're going to admit patients. So patients leaving and coming to the unit, that's called throughput. And you're going to have to, be responsible for safely getting people out of there and safely admitting people.